Crowley, Mayor Cavalier Johnson, and Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County. Thank you all for being here. And County Executive Crowley, I'll hand things over to you to get us started.
Well, thank you so much, Catherine, and good afternoon to everyone. I hope everybody is enjoying themselves. So I just want to first start off today by informing you all that the county, we still have masks available for pickup at our Marcia Cox Center, which is located at 1200 West Valete Street. And so when you think about these masks, you can pick them up on the third floor anytime between 8 a.m. and 3:30 p.m. Again, these are free masks and they're available to anyone in the public. And so although we're seeing the COVID-19 cases in our community decreasing at this time, it's still important that we wear a mask, especially in crowded areas or in public areas, as everyone is experiencing the risk of contracting this disease, COVID-19, pretty differently. And so we want to remain committed. The county wants to remain committed in providing these resources to the community to make sure that you can keep them and yourselves safe and others safe from this deadly disease. But we also want to make sure that you pick up some of these masks while the supplies last. So please come and get these masks if you need them. And so yesterday, I know some people out there, had some days off when we think about the celebration of President's Day. But I want to also take some time to talk about the fact that and recognize and remember the civil rights icon, John R. Lewis, the late congressman who passed in 2020. He served as one of the big six leaders of groups among Martin Luther King Jr., who organized the 1963 March on Washington for Jobs and Freedom. And he fulfilled many key roles in the civil rights movement and his actions to end legalized racial segregation throughout the United States. And so Lewis was awarded the Presidential Medal of Freedom by former President Obama, who called him the conscience of the United States Congress. And last year, Milwaukee County Supervisor Felicia Martin, she sponsored and the board supported unanimously and adopted a resolution dedicating February 21st in Milwaukee County to this civil rights leader and longtime member of Congress. And when you think about, Congressman Lewis, he's played a pivotal role in civil justice and social justice, as well as voting rights. So it's appropriate that we bring this icon forward and continue to honor his legacy in Milwaukee County history. And then the last thing I just want to mention is that I want to remind folks that I will be presenting the State of the County address tomorrow, Wednesday at noon. So where we'll be covering our response and all the county employees in an effort to really stop the spread of COVID-19 over the last year, but also to highlight, what opportunities lie ahead for this community in this new pandemic landscape and the data-driven approach that we're taking as a county as we continue to monitor and evaluate the trends in our community. And so you can watch the speech live via the Milwaukee County's Facebook page and on YouTube. And so there will also be media opportunities immediately available afterwards. And I want to encourage the media to reach out to us at press@milwaukeecounty.gov to receive login credentials. So thank you again for joining us, and I'll hand it over to Mayor Johnson.
It looks like we lost Mayor Johnson. I know he was having some technical issues. So Dr. Weston, maybe we can hand things over to you.
Sure, thank you. Good afternoon. First to our numbers, we're currently seeing in Milwaukee County an average of 112 new cases per day and about 2 deaths per day. Our trends continue to decline very nicely. Our positivity is finally nearing 5% and will likely cross that important threshold in the next week. Hospitalizations are coming down. They're lingering a bit as some sick folks certainly remain hospitalized, but they are declining. And deaths are declining as well. These are all good signs, and we're seeing them statewide as well as nationally. Now, though our numbers are receding, we've seen this before. We've all been through this before. Though many of us want to be done with the pandemic is likely not done with us. However, on a positive note, we are in a different place now than we've been in the past. And much of that is due to the availability of the vaccine and the booster. Vaccination is our path forward out of the pandemic. And as we learn more about the promising effects of the vaccine against this virus, we see more and more that the COVID vaccine should really be considered 3-dose vaccines. That third dose, or what's commonly referred to as a booster dose, really strengthens the protection that comes from the vaccine. A recent study reviewing data from a network of 10 states over 6 months looked at the effectiveness of the vaccine and booster in preventing urgent care and emergency department visits for COVID, as well as preventing hospitalizations. Now, while the 2-dose vaccine provided substantial protection against these medical needs, that protection declined in those who were over 6 months out from that second dose. When they were given a third dose or a booster dose, however, that effectiveness in preventing medical needs for COVID rose back up to about 90%. And that was for both Delta and more recently for Omicron as well. So the booster is critical. And when we look specifically at our medically vulnerable age group, those 65 and older, those who are unvaccinated are 51 times more likely to get hospitalized with COVID than those who are boosted, 51 times more likely. So considering how critical the booster is, how are we doing as a county? Now, overall, when we look at the folks in our county who are eligible for their booster, that is to say 5 months after your last Pfizer or Moderna dose, or 2 months after Johnson & Johnson. Now, among those eligible people, only 58% have received their booster. Now, considering that medically vulnerable age group of 65 and older, 78%, that leaves 22% of this older age group that's not maximally protected against poor outcomes, 22%. Now, as we've seen with the initial vaccination efforts, we're also seeing notable equity gaps in boosting as well. Whereas 67% of our eligible white population has been boosted, this goes down to 49% for our African American population and 42% for our Hispanic population. Now, there's a lot more booster data that we have to share that gets into more detail, and I've shared it for now on Twitter. It's at Ben W. Weston. We're working to get this data incorporated into our public-facing dashboard in Milwaukee County's ongoing commitment to a transparent, equity-focused, and data-driven approach to the pandemic. The bottom line is vaccines work, and boosters make them work even better. Vaccination makes you less likely to get infected, but breakthrough infections can occur. And as we've seen in those cases, it makes you less likely to get severe disease, less likely to need hospitalization, and less likely to die. And by the way, less likely to transmit the disease to others as well. That's why getting vaccinated is not just for you. It's for your family, your coworkers, your classmates, and your community. So take this moment of low disease burden and use it to prepare for whatever may come next. Get yourself vaccinated or get yourself boosted. Allow that immunity to build in this safer environment so that whatever variant comes next, and with our global state of vaccination, a new variant will come. You will be prepared, and your family will be prepared. Thank you very much. Stay safe, and I'll hand it back to Catherine.
Thank you, Dr. Weston. We'll now circle back to Mayor Johnson for an update. Well, we did have him, but he might have had technical issues again. So while we wait for the mayor to join us, if he is able, I will just open the chat up for media questions. We'll see if the mayor is able to join us. Otherwise, we would conclude early. Okay, we've got one question here coming in from Drake Bentley with the Milwaukee Journal-Sentinel for the county executive or Dr. Weston. The majority of Black residents continue to be unvaccinated, at least statewide, with the pandemic ending being debated. What would you say to the majority of Black residents that have decided the vaccine is not for them?
Well, I'm happy to go first, and then unless you'd like to, County Executive.
Go ahead. Ben.
Okay, so I guess I would slightly counter that narrative, Drake, and I would say that the people who are not yet vaccinated, I think often fall into two groups. So one of those groups is people who will not get vaccinated. The other group are people who still have barriers or still have some misinformation about the vaccine. And when we look at national data, we see that vulnerable populations quite often fall into that latter group with either barriers or misinformation. And so you can imagine a single parent who has a couple kids, works 2 jobs, doesn't have a car. And so they may have a very small window of time when they can go to that vaccine clinic. And in that small window of time, they have to put their kids on a bus. They have to take them across town to get to that vaccine clinic. And on top of that, if they're day in and day out told misinformation about the vaccine, that motivation to get on that bus and to travel across town and to drag your kids with you is going to go down. So I think we still have work to do in Milwaukee County, particularly among our vulnerable populations. We use things like the EVE model to inform that work. Where should we message? Where should our interventions be? But my message to anybody who hasn't yet been vaccinated is there's overwhelming evidence that the vaccine works. There's overwhelming evidence that the vaccine is safe. And we're trying our best to break down barriers, break down misinformation, and get the vaccine as easily accessible to you as possible.
Thank you for that answer, Dr. Weston. And I would echo what he just said, but I think when we talk about anyone, whether they're Black, Hispanic, any person of color or white, about the importance of getting this vaccine, it's really about saving those around you. Again, when we think about who has been affected and how this affects everyone differently, it's really about how we all see us coming to the table and really moving this community forward so we can all enjoy the freedoms that we all had prior to this pandemic. And so I think it's extremely important that we don't, when we talk about this, that this is about how we get everybody vaccinated across this community. And we know that right here in Milwaukee County, where we have the largest population of African Americans, Black people living in the state, we're going to see the majority of those folks right here. But I think it's important that when we think about this statewide and nationwide, it's important that we have conversations to really bat down a lot of the misinformation that is out there and really break down many of the barriers that people have in getting access, not just to this vaccine, but any healthcare access.
Our next question comes from Nick Bohr with WISN for Dr. Weston. He's wondering, how comfortable are you with the city mask mandate expiring next week?
Well, I'm sure this is front of mind for any leaders in the city and in the health department in the city as well. What I think is we won't have mitigation measures forever. We're not going to be wearing masks in public forever. We're not going to be distancing in public forever. And now, as the disease burden goes down, is the time to start thinking about how we move forward. But I think when we move forward, it needs to be data-driven. It needs to be transparent. It needs to be equitable. And it needs to be informed by experts such as Commissioner Johnson, such as others, health department and public health and medical leaders in our community. So I hope that happens. I think that is happening in all our communities through Milwaukee County, as well as the state and nationally.
Thank you, Dr. Weston. I do see we have the mayor. I will give you just a quick minute to breathe. I'll ask one more question and then we'll jump back to an update from Mayor Johnson here. So Rose Schmidt does have 2 questions. I'll ask the second part of that question for whoever's able to answer. This being, health departments in other counties have announced they are ceasing contact tracing for people who test positive for COVID-19. Are Milwaukee and the rest of the county still doing contact tracing, and do you have a plan for this to continue?
So for that question, I would defer to our health officers, and I think we can circle back with an answer from them.
Perfect. We will do that, Rose. And then Mayor Johnson, are you with us?
Yes, I'm with you. Sorry about my technical difficulties, and I'm on a couple of different devices right now. And I'm also at home, so please bear with me if you hear small children in the background. Okay, so good afternoon, everyone. Let me begin today by talking about a weather-related announcement. I've just issued a weather emergency declaration that emphasizes the dangers associated with travel and allows for closure of various city government offices. The City of Milwaukee Health Department closed COVID-19 services at all clinic operations at the Northwest Health Center, the Southside Health Center, and the Keenan Health Clinic today as well. COVID-19 testing and vaccination services remain open at the Menominee Valley site today from 9 until 3. Regular clinic hours will resume tomorrow from noon until 6 at the Menominee Valley site. The Northwest and South Side health centers are closed for COVID services on Wednesdays. Libraries throughout the city are also closing for the remainder of the day. Other city offices will be closed to the public by 3 p.m. today. I've given city departments the flexibility to send in-person workers home if that is appropriate, while essential city employees will remain on the job. The Department of Public Works has reported to me that it's facing difficulty maintaining safe travel, particularly on sidewalks with the combination of ice and rain and the sub-freezing temperatures that we're seeing in the city, in our region right now. Various DPW crews have been redeployed to ice control. That will impact some garbage and recycling collection, so folks should be aware of that as well. Public Works crews will continue to work to manage the icing on the city streets, and I anticipate lifting the emergency declaration by tomorrow morning. Back now to COVID and our gating metrics. Today, I have more great news to share as I provide an update on our COVID-19 gating metrics for the week. We've now dropped from the high transmission to substantial transmission categories for COVID-19 cases per 100,000, down to 83.2 cases per 100,000. Our COVID-19 cases per 100,000 have not dropped to the substantial transmission category and under 99 mark since July 29th of last year. That's over 6 months ago. And our percent positivity rate remains in the moderate transmission category, down to 5%. Our vaccination rates are these. So 63.1% of City of Milwaukee adults, those are individuals 16 years of age and older, are fully vaccinated. 68.7% of adults are vaccinated with at least one dose, and 44.9% are fully vaccinated with a booster dose. I want to continue to see our vaccination rates increase here in our city. The Milwaukee Health Department continues its partnership with Milwaukee Public Schools to provide vaccines to students, to staff, and the community through mobile clinics until March 1st. We're near the end of our school-based clinics. I'd like to report that the health department has administered a total of 825 doses of vaccine through these locations. It remains critically important that we increase our vaccination rates in children. Boosters are available and an important part of our vaccination efforts as well. Here's a brief summary of all mobile vaccination clinics for the week. So on Wednesday, February 23rd, from 10 a.m. until 2 p.m. at UW Milwaukee Union. Also on Wednesday from 1 to 4 at Ascension All Saints Family Health Center, 3 to 5 at La Causa. On Thursday, February 24th, 1 to 4 at Jackson Early Childhood and Elementary School, from 4 to 6 p.m. at the United Community Center. And then on Monday, February 28th, 1 to 4 at Longview School. Tuesday, March 1st, from 10 a.m. until 1 p.m. at Marquette University, AMU. And then 1 to 4 at Hopkins Lloyd's Community School. And as always, a schedule of all the clinics are available on our website, milwaukee.gov/COVIDvax. Thank you so much, and sorry about my technical difficulties today.
No worries. We're happy you're able to join. And we got through most of the questions. There is just one for you from Rose Schmidt. She's wondering, Milwaukee's mask mandate is in effect until March 1st. Will you extend it beyond that date?
It is not my intention to have the mask mandate extend beyond March 1st. When we get to March 1st and it expires, it'll expire. It'll take action from the council to extend it farther than that. And so it's not my intention at this time at all to see an extension of the mask mandate in Milwaukee.
Thank you, Mayor. And one additional question coming in for the county executive from Sean Kirkby with Wisconsin Health News. He says, the Wisconsin Policy Forum and UW released reports last week looking at public health in Milwaukee County. What is your reaction to the reports? Do you see the need for the county to play a greater role in public health? And if so, what would you like to see the county doing that it hasn't done before?
Great question. You know, I think this report actually tries to help us actually answer the question, why doesn't Milwaukee County kind of have a health department, which, you know, being the largest county in the state of Wisconsin, being the only county that it does beg the question. But I think this just, leads to a broader conversation that we have to have just in general around government and how we do business across all the different municipalities throughout Milwaukee County. But a great question.
A few other questions coming in here. Drake Bentley with Milwaukee Journal Sentinel says, for Mayor Johnson and County Executive Crowley, how do you combat misinformation from predominant Black leaders who have even taken to radio airways with their beliefs?
I think we combat that information by bringing on the experts on COVID-19 and our professionals, the folks who've been working on the front lines of COVID ever since the pandemic struck our community more than 2 years ago with briefings like these. And we let people know and we level with people in our community about the effectiveness of vaccines and the need to mask where appropriate. And using all the mitigation steps that we have been using in order to combat COVID-19. So whether or not somebody is, spreading misinformation in multiple ways as it relates to the media, it's important for us to make sure that we step up and deliver the actual truth of the matter and the actual appropriate message, just like we do on these briefings every single Tuesday, and we'll continue to do that.
Absolutely. I mean, when you think about misinformation, that misinformation has been here for a long time. Prior to this pandemic, when you think about radio, when you think about TV, when you think about, Facebook and all the other social media platforms that are out there. But this is about how do you also reach out to credible messengers. When you think about people just telling their story about why they received the vaccines and who they've protected, but also those who have been saved because of this vaccine. And so it's extremely important that we just continue to talk about why this is a good thing, why this is a public health crisis. But if we want to continue to have this conversation, we need everybody to be a part of it. And that includes those who are putting that misinformation out there and really giving them the information that they need, because a lot of the times they are not getting the right information. So it's about how we continue to just hammer this message across this community. But I think that, we're doing everything that we can. But again, we need to be focusing on credible messengers throughout this community to really spread this message.
And then just one further point of clarification for the mayor. Rochman is wondering if you are going to look to the council to further create action for the mask mandate.
No, I'm not seeking for the council to extend the mask mandate. I've been very clear in the time that I've been mayor of this city that I'm relying on the experts on COVID-19, our professionals in the health field here, to guide my decision-making as it relates to COVID. It's not a political conversation. It shouldn't have been at all, and I don't believe that it should be in the future. So if the health apparatus in our community feels that it's appropriate for the mask mandate to expire, then I'm going to follow that advice. If there's no desire to have the council to extend it, then I'm comfortable with letting it expire on March 1st, as we previously had stated.
Thank you, Mayor Johnson.
Welcome.
All right. Well, we made it through. Thank you all for joining. Thank you, media, for the great questions. And that will conclude today's briefing. Stay safe out there, and we'll see you next week.
Thanks, everyone.
Thank you.